90-90 hip lift with hip shift. Lie on your back with your feet flat on a wall and your knees and hips bent at a 90-degree angle. Place a 4 to 6 inch ball between your knees. Inhale through your nose and exhale through your mouth, performing a pelvic tilt so that your tailbone is raised slightly off the mat. Keep your back flat on the mat. As you maintain a hip lift, shift your left knee down and your right hip up so that your right knee is slightly above the left. 90-90 hip lift with hip shift, in addition to being found in the Myokinematic Restoration Repositioning program. This technique can also be found in the left hamstring, left ischiocondylar adductor, and left hip flexor inhibition programs.
The title of this technique is a little sentimental for me because I reflect back on my history of putting patients in this position, and I had a difficult time asking myself, how do I explain this position? And better yet, why this position? So the title really means a lot. 90-90 degrees, 90-90 degrees, 90 degrees of the knee and 90 degrees of the hip. It's halfway between a full squat and a full stance. It's our way of our body knowing that we're in transition. We sit in transition all day long. Our spine requires it. We have a body that's made off of rotation off this position. When we came out of the womb, we were in a flexed state, and we operate by extending ourselves through this transitional state. We get in and out of chairs. We need muscles that help us rotate internally when we leave and enter this state. So anywhere between 90 and 90, 100, 100, 60, 60, there has to be some internal rotation going on in our body.
Standing resisted trunk around with left AFIR, right trunk rotation, and balloon. Stand facing away from the door with tubing in your left hand and a balloon in your right hand. Shift your left hip back and slightly bend both knees. You should feel your left outer hip buttock engage. Keeping your left hip back and weight through your left midfoot heel. Reach out across the midline of your body with your left hand as you bring your right arm behind you and your right foot in front of you. Your trunk should be slightly side bent to the left. You should feel your left abdominal wall engage. Standing resisted trunk around with left AFIR, right trunk rotation, and balloon. In addition to being found in the Postural Respiration Repositioning program, this technique can also be found in left gluteus medius and integration programs.
In the title, the word resisted exists, and there are two areas that are resisted. One is her lungs are going to feel this resistance provided to that pleural cavity by a balloon that's going to be in her mouth with a band that's going to be on her hand that's going to make her have to work at the same time she's breathing in her abdominal wall, specifically on the left side, as we'll go through and dissect out for you. But she's got a balloon in one hand, which is providing the resistance to her abs and her hamstring. And then she's got a band in the other hand that's providing resistance to her hamstring and her abdominal wall. So when that arm goes forward, she's feeling that hamstring on the left side engaging while she keeps that heel down on that left side to advance that band forward. So we're sprinkling in some good awareness of how to keep her pelvis posteriorly rotated on the left side with that band that's resisting her activity of hip flexion. She's using this resistance band to engage the floor with. By putting the resistance through her left hand, she has to lean a little bit forward on that left side. She has to engage her hamstrings. She has to engage her left abdominal wall, and she's going to sense that need for her to strike that heel hard, get back on that heel, let the floor support her on that left side. She's actually learning how to stabilize her body with the center of mass more to the left now than the right.
All four, right arm reach. Place a 1 to 2 inch folded towel under your left knee. Position yourself on your hands and knees with your back rounded. Step forward with your right arm and right knee as you side bend to the left. Keep your weight forward and to the left. Your nose should be over your left index finger. You should feel your left abdominals. Inhale through your nose and exhale through your mouth as you reach forward and to the left with your right arm. All four, right arm reach. In addition to being found in the Pelvis Restoration Repositioning program, this technique can also be found in right lower trapezius and right tricep, left lower trapezius and left serratus anterior, right intercostal inhibition, right rectus femoris and sartorius, left anterior inlet inhibition, left posterior outlet inhibition, and integration programs.
This technique, again, is an all-four positional technique, and which makes it immediately a technique that's going to put Hannah in a position where gravity is going to have a major impact on what she senses and feels. We actually now have her away from the wall, and she's now independent of all the walls around her, everything above her, except for what's below her. The left knee is going to become her pivotal point for this pelvis-like activity. It's pelvis-like from the standpoint that most of her activity is going to be generated by what's underneath her left knee, and it's a towel that's either 1 inch, 2 inches. And I would make sure when you put that towel under her knee that it's not creating, discomfort, because she wants to feel comfortable. We shifted her hip towards gravity. We shifted it up, and we made her femur longer on the left side. Her brain is saying, I have a longer femur. Well, really, she doesn't have a longer femur. She has a shorter one now on the right side, which means the right side's got to work more for movement than the left side. Since we made the right one shorter, the left one is her dynamic femur. That gives her pelvis and her thorax, along with the abdomen, a different feeling and a different meaning. We've actually split her in two with that towel. So this is a wonderful technique to engage left pelvis inlet adduction while she's figuring out how to use this new right outlet adduction in the pelvis at the same time.